So as it was mentioned before, the history shows that veterinarians and
You get as close as you can to the mic.
okay.
And I can't hear it.
Is this working?
That one I don't think will work.
No, you mustn't use that one.
Yeah, this one.
Just
Okay.
get as close as you can.
All right. So as Dr. Tobin was mentioned before, the veterinarians and farrier profession was once just one profession. It was with the development of veterinary schools where the profession got more specialized as veterinarians, and it drove the impact of science toward other areas of the specialty as veterinarians. And the farriery, those skills kind of were devoted more towards the farriers. But we know that there's a lot of lack communication between the farriers and veterinarians, which kind of disconnect these two professions. We know the contributions that are brought by the farriers towards all of us as horsemen. We have to acknowledge these contributions, and once we do, we can realize how we need to integrate our communication from the standpoint of veterinarians. First of all, the farriers maintain a normal structure and proper hoof growth. The foot is great about adjusting to those environmental changes, and the farrier is always modulating that shape of the foot towards those changes are created. And then we've seen that in the previous lecture. So farriers are constant battling those environmental elements towards the foot. Abnormal hoof conformation, that's a given. We've seen that, we've talked to farriers about it. They're constantly trying to give that normal shape to the foot that it should have as a proper organ for the ability of the horse to move at a normal gait. Limb conformation in foals, this is a big one to me because working here in central Kentucky, I saw how the farriers could help the foals that had abnormal conformations to where they were possibly high surgical candidates to fix those abnormal conformations. But as we saw, and as I saw, with the proper training of farriers, they were able to correct these conformations, and the numbers are outstanding when you start seeing these foals with abnormal conformation. And some of them, they kind of grow out of it, yes, but a lot of them, the farrier is the one that's pushing it to become more normal and not need any surgical procedure to acquire a normal conformation. Also, we see constantly farriers working as far as helping the horse with lameness and pain related to the foot. So farriers are always adjusting the shoeing therapy that they're going to apply to a horse depending on what they feel the horse will be more comfortable. Improving performance, that's something that it takes in, the expectations from the owner standpoint. Farriers are always trying to do that because that's a given. That's what comes with the profession. The horsemanship, clients are going to ask for horsemanship, otherwise they will not hire that type of farrier. And when it comes to therapeutic shoeing, we're going to talk about it a little bit more, but that's when the two professions can get together for the best care of the horse. So the veterinarian's requirement now. And this is very important because not every veterinarian will be prepared to work not just with the equine species, but also with the foot abnormalities. The veterinarians will require a broad range of clinical knowledge. That means with small animal or large animal. But they will require a specific knowledge to deal with our clients. The emphasis on the equine practice. They don't only need to know as a well-rounded veterinarian, but they need to have an emphasis on the equine practice. And they take the best advantage when they are in cooperation with a farrier. Not all veterinarians, like we see in this area in central Kentucky and other states, but they're more specialists towards the podiatry field. But we have a lot of veterinarians that are very good with the skills of farrier, and they know the proper way to shoe a horse. And most of those veterinarians have a good relationship with farriers. So it's at the same time, to bring their veterinary skills to the table, they should use the gold standard and all appropriate diagnostic tools. When veterinarians should communicate with farriers, not only because the foot will be affected where they need to change the shoeing protocol, but also just to communicate what exactly is happening with the animal systemically. Because as we've seen, those systemic aberrations will insult and impact the growth of the foot. So now the therapeutic shoeing, and this goes to farriers or veterinarians. There's essential training and standards that are set once you start treating horses therapeutically. But there's a broad range of treatments, and this becomes from the simple standpoint of removing a shoe that at the moment in time where the shoe was in the horse is not working on the advantage of the foot. That doesn't mean that it was wrongly put to that horse. It's at the moment in time that the horse was looked, that shoe and that shoeing protocol is not the best for him to recover. So just taking that shoe off and giving a normal foot conformation has already been therapeutic for that horse. So now you can see how you can set the bars for this therapeutic shoeing. And the bottom line is, if you're going to decide to invest your time in therapeutically concentrating in the foot, you need to make sure you have the most advanced diagnostic tools and the latest proven treatments that there is, and you're very familiarized with those. So now the lack of proper training and expertise from both sides, from veterinarians or from farriers, can open the doors for critics because things are not properly done or because the horses are not improving at the rate they should be. So this creates a more of disagreement. But when you bring both of the professions together and you develop meticulous plans, these things don't happen. I mean, both professions will assume that we took consideration on applying that plan, and is it working or not? Now, it's not working because we applied the wrong plan. It's because things have changed and we need to modulate it and come up with another plan. So to me, working with farriers in my practice, we develop the plans together and we kind of marry to that plan. And if the plan went south, we never look back and say, well, we should have gone the other direction. No, we need to make a new plan and follow that direction where we want to go. So now let's look at the reality here. What are the owner's expectations of a farrier? The owner's expectations of a farrier are responsible and competitive of working with horses. They should have adequate knowledge and expertise when it comes to farriery. They should know about blacksmithing and being good at the forge. They should also know about synthetic shoeing. They should be a true horseman. They should have their certifications, and they also should have a basic medical knowledge related to the foot. And that says a lot, because now you're asking the farrier to know about medical things related to the foot. But yes, I agree, and I think farriers should look more into the medical conditions that could be affecting the foot. And that's because if you are not paying attention on what's happening systemically, even though you are not responsible for that, I don't think you will be successful treating the foot. So now, in my opinion, the farrier comes as a first line of defense from the horse. And we see this on a daily basis. I believe farriers know the horse sometimes more than their own owner. They are underneath this horse. They flex all four legs. They look at the bottom of their feet. They all sometimes see the horse defecate in front of them. So they know everything about this horse, and sometimes more than the owner of the horse. And now we're going to focus on some medical conditions that I think we as a farrier should know they're present, not for you to be responsible for those medical conditions, other than raising maybe a flag, maybe raising a concern, making a recommendation that something needs to be done, or there may be something there that is affecting the foot towards what you're doing, trying to get this horse sound or trying to prevent something that's happening. So I have to start with the overweight horse. I mean, we all seen it. It's very common, and it's a very touchy subject to present to owners. I live it every day because I have to make recommendations toward this condition, and it's not an easy one. It's not an easy way or professional way to present this to owners. You could offend some clients if you tell them that the horse is overweight. So it's a very difficult subject to present. There are two types of overweight horses. There is the overly fed and the easy keeper. And the only way to know this is by asking the owners, how much are you feeding your horse? There's no other way. They both are going to be overweight, and the only way to know is to ask the owners. And basically, the easy keeper, they will tell you, I'm not feeding anything other than hay, and he's this overweight. And the overly fed, they're going to tell you they're feeding something, That's something you will have to take in consideration. I mean, they done plenty of studies measuring and criticizing the way the owners and horsemen measure the feed for horses. So if they tell you, I just give him one scoop, just go and look at that scoop, because it may be a different type of scoop that you're used to feed your horses, and you'll be surprised. Anyway, I think as farriers and veterinarians and professionals, we should accustom to use the scales to communicate. This will tie up our communication skill with the veterinarian, the client, or any other colleague. The Henneke body score condition was developed, and I use it probably just to put in the record where we are today. And I think farriers should do the same thing, especially when they're trying to drive the message to that client that the horse is overweight, that we need to do something about it. The scale goes from 1 to 9, 5 being the moderate, and that's kind of where we want our horses to be at, but not every horse. We need to look what the purpose of the horse is for, because if you may have a thoroughbred on a scale of 5, that may not work out for the proper training or where it needs to be at that stage of its life. So again, you have to put this in perspective of what the animal you're working with. But bottom line is, a 1 is emaciated and 9 is heavily overweight, okay? Now let's focus on those overweight horses a little bit more, and we're gonna start running into the equine metabolic syndrome that most of you guys know what it is. So basically, they got 3 principal components. Is increased adiposity, which is abnormal fat depositions in the body, which we're gonna cover. Insulin resistant, which is actually the main pathological process that we believe is affecting these horses. These horses could have hyperinsulinemia at times, and we're gonna talk about how we can correlate that to the disease process which associated them with laminitis. But the clinical presentation of these horses could vary, and that's what we need to be focused now. So these horses could just come as being overweight, having those generalized obesity and abnormal fat depositions, or also they could present laminitic. So now we need to go back to basics and say how they're doing systemically. And the first ones to see those cases that present with laminitis, because it may be mild, will be the farrier. So here are the abnormal fat depositions presented most of the time with this type of horses: the neck, the withers area, and the shoulder and elbow, as well as the tail base. And those, I mean, I'll have better pictures than this, but what I'm trying, this is my daughter here, and this is the horse that she rides, and obviously the only time that he gets grass is during this time. This horse is actually in great shape right now, but it's very, very difficult to manage their weight and control them when they're only allowed to eat grass just a few seconds a day. Now, the predisposition for equine metabolic syndrome is pretty general. We have breeds, as far as pony breeds are very good at metabolizing their calories and putting it into fats. Morgan horses, Pasofinos, Arabian, saddlebreds, quarter horses, and Tennessee walking horses. And we have to put there the thoroughbreds, because in this area in Kentucky, as you can see, there's a lot of overweight mares that live a good quality of life. Those farms could be managed by veterinarians, but because the public perception, we want to see these brood mares very round, which is fine, but there is a very fine line between that roundness and having healthy feet. Especially when they're brood mares. And we see them all the time. We see mares that when they're about to fall in the latest term of gestation, that's when they start crumbling in their feet, and we start battling laminitis and so on, and other type of problems related to the foot. For example, this is a thoroughbred mare, and right now she's not obese because she's been hospitalized for a month suffering from laminitis. We started with this, and we end up with tenotomies and so on, trying to save her life. After all that, she aborted her fetus, and he was autolyzed, but these type of cases, you see them on the breeding season here in Kentucky, not very often. You probably see 2 or 3 a year, but at the same time, when we look at these mares out in the pasture, we know that they're suffering from a degree of laminitis, not to the point to be crippled, but at the same time not to be healthy and have a normal healthy foot. With EMS, there are a couple signs that we could be paying attention as horsemen, as farriers, that there could be something abnormal. And these fat depositions, they tend to isolate in specific areas that we can pinpoint and kind of drive the message to the owners. I mean, when geldings get overweight, they develop a lot of fat deposition in the prepuce. That fat deposition could become vicious because there's the pendulous aspect of the prepuce, which is going to collect edema. And once the edema is collected, you get severe enlargement of that prepuce, which it could be a pretty tough case to battle to resolve it. With equine metabolic syndrome, it's been proved scientifically that these horses, when they are exposed or at risk from any other major systemic insult, they are more at risk of developing laminitis, and that goes with grain overload, retained fetal membranes, and colitis. So now more reason to be very cautious with those broodmares here in central Kentucky, especially when they retain a placenta or they go through a severe foaling event where the vaginal canal was traumatized as well as the uterus. So those horses are very at risk from developing laminitis, and we will touch the basis as far as systemic inflammatory response syndrome, which is the syndrome that is created within the system where the systemic inflammation is so severe that triggers multi-organ disease, and we'll cover that at the end of the lecture. So these episodes of laminitis related to equine metabolic syndrome happen, and we know when they happen. They happen during that rapid growth of the grasses. We've seen it here in Kentucky. We know how the environment behaves when it rains and the sun comes out. That grass gets very lush and very green, and then we see the cases. I mean, the farriers can tell you about that. I mean, that's more for the horsemen now, because the farriers can tell you that the laminated cases are coming because it rained last week, and they've been probably on that grass with no type of control. And it's been proved now from the metabolic standpoint what triggered this effect, what triggered the laminitis episodes from this metabolic syndrome horses. And what we've been able, or scientifically is being able to be improved, is that the glucose and insulin dysregulation creates a trigger effect. We've been able to create and modulate laminitis, infusing insulin to horses and creating hyperinsulinemia. So we know that glucose rush and the insulin coming to take care of that hyperglycemia effect is creating and triggering the laminitic episode. What exactly happened after that hyperglycemic episode, we're still trying to figure it out. But definitely that hyperglycemia is a major trigger for the laminitis. One thing, since we are going to focus on those little signs to find out this metabolic horses and kind of raise a concern that these horses could be at risk of developing laminitis, they did several studies where they measure the neck of horses, trying to find a major sign where they could focus their diagnostics towards equine metabolic syndrome. And as far as they found a very good correlation between, for example, score number 3 with equine metabolic syndrome. And I use this to guide myself. I don't think you need to be a scientist to say, well, this horse look overweight. I think it does help me a lot to drive a message. And also, once you grade the animal or the horse, now you can say how the horse is progressively getting better, and now bring it to a grade 2. And the owners start realizing these things and these criteria, and maybe getting into it to make the horse feel better or lower the risk of laminitis. I put these pictures here. This is a client, a previous client of mine, ponies, and these are very athletic ponies. Again, you have to take in consideration what the animal you're dealing with. These athletic ponies are in top shape, but because of their breed, they have a thick neck as well. So you can't go into this barn and tell this lady that these horses are overweight because the type of breed it is. So you have to be very careful when you use this type of sign, okay? At the same time, if you see a teaser with this neck, no matter how dark it is or how bad the picture is, I can tell you that this is an equine metabolic syndrome. And if you get close and look at his feet, I mean, you can probably prove it, okay? So again, why we're so focused on these signs from equine metabolic syndrome, and it's because the diagnostic is not that easy. I mean, their diagnostic is not simple. It's kind of tedious. And by the time you diagnose the horse, you could be doing a lot of other therapies that did not require any medical management. They were just management of the horse. So as you can see, there are several ways to do it. But the bottom line is while you're starting to raise a concern about equine metabolic syndrome, there are things that could be done to prevent it, no matter if they have called a veterinarian or not. A lot of those horses that present with laminitis, obviously you can't exercise them, but exercise will be the primary line of defense for equine metabolic syndrome. These horses that are not under exercise, then we need to work them under the prospect as far as diet it comes. And we're going to limit the sugars, so basically no carbohydrates at all to these horses. These horses should be living on a high fiber diet and zero carbohydrates. We need to manage and control their hay intake and what type of hay we give them to. So these horses will be in the cheapest hay in town. No reason to feed them a high quality hay. And if you do, I'll show you what I do, but basically on these horses we want to control every minute. They're constant eaters, so we want to provide the fiber to them, but at the same time we want to provide the minimum of it. And the way I see it is that, and the way I tell clients, is that horses are very good energy producers. They are like cows. They ferment feed, and they create energy from that fermentation process. They do it in the large colon. So it doesn't matter basically if you're feeding them or not. They're fermenting that feed in the large colon and continuously creating energy out of it. So by that, sometimes it doesn't matter how little you feed them, they still gain weight, and those are very, very tedious to treat. So sometimes you're making all these tedious recommendations to the owner and the horse still not lose weight. But you have to do this first. And this is a great way to control their intake. If you only have rich or very nice hay in your barn, and you can go out and buy another different kind of hay because you can't stock the hay in that room you have it, you can soak it in water. It's another process to go through in the mornings, but it will take a lot of the nutrients out of that hay, making it appropriate to be fed to an equine metabolic syndrome horse. Obviously, controlling the grasses, the access to the grass is a major. It's not easy sometimes to put a muzzle on a horse, but it sometimes is the only solution. And horses have plenty of skills sometimes to take them off and lose them in the field. So you make a recommendation to an owner, the owner goes buy the muzzle, they spend the money, they put it on, and 2 days later the muzzle is nowhere to be found. And they lose the money, so it's very tedious to convince owners. You can't impose this to them. You have to just mention them and easily be working with them and see what works in the routine that they're doing. Otherwise, they're not going to take it seriously. You can pinpoint as well that another routines to avoid the pasture access. I've seen people that fence with electric fence, and they actually kill the grass there, and they have a dry lot in that area, and they allow the horses to have access to the green pastures, periodically. But if they're going to do that, grazing at night or in the early morning is the safer, except when the grass is being through a frost base, because they will hold more glucose in the leaves at that stage. Now we're going to go into Cushing disease, equine Cushing disease. We know the term is pituitary parts intermedia dysfunction. That's the scientific term that we have given. And so basically is a neurodegenerative disease with the loss of dopaminergic inhibition. And I will embark more on that. Sound pretty boring, which it is. So you have to get into it. And I know as a horseman, it's very difficult to get into these medical terms, but if you try, you will get something out, which I'm guarantee you it will help you in your routine. So basically, it's a slow progressive disease that primarily affect age horses, so horses that are over 18 years of age. And now, they're still boring. I'm going to try to do my best, but it's basically the hypothalamus and the pituitary interactions, what it gets affected in these horses. And these interactions are highly regulated. They're involved in many functions or systemic functions of the horse. So this is the diagram that is best explain what exactly happened and what the primary problem is in Cushing disease. So basically we have here the hypothalamus, we have the pituitary, and basically the hypothalamus is the one that controls the pituitary. And it controls the pituitary by this periventricular neurons. So it's actually a nerve signal that is sent to the pituitary So what happened in these Cushing horses or the PPID horses is that terminals kind of gets damaged. It's from the oxidative stress, and that's what we believe. We haven't been able to pinpoint why exactly these terminals neurons get affected, but the hypothalamus lose control of that part, only that part of the pituitary, the intermedia. And by losing control, it can't suppress it. So because it can't suppress it, the pars intermedia start functioning without any type of control. By that means that it produces ACTH in an abnormal levels. And ACTH is devoted to trigger the adrenal gland to act and produce the products that the adrenal gland should release. So it only happens, or mainly happens, on age horses, commonly 18 years over. Does not differ from females and males, but is very well written in the literature that any age horse that's suffering from chronic laminitis, it should be investigated as a Cushing disease horse. If now we can look back and say, well, I've seen some of these horses that are not age or geriatric horses, but they are suffering from laminitis. They don't look like a Cushing disease, but may be. And those are the horses that you, as a farrier, as a horseman, should be kind of raising the concern of Cushing disease being a primary problem for why this horse is having poor feet conformation. And this is an age horse. I mean, a case that I was involved on a 30-something-year-old horse. We've seen these horses more and more in the population. These horses, the owners are more aware of their conditions. They seem to care more to keep their horse as a pet. I have plenty of clients that prefer to keep their pet horse than their actual horse they're performing at. Because they grew up with this horse and they will do anything for these horses. And now with the veterinary science on our side, we can make these horses last longer. With the care that farriers do to their feet, they can protect these horses from failing at the hoof level. So we see these horses more commonly. Cushing horses can present in many, many ways, and I'm going to try to pinpoint those areas. That way you guys raise the concern of horses suffering from Cushing disease. So hirsutism is basically that curly, long, shaggy hair coat. Is one of the most unique and specific clinical signs that Cushing horses will present with. If the horse have this long, curly coat, is 5 times more likely to have Cushing disease. You have to take in consideration that there's some breeds that who will have a long shaggy hair coat like that, and that's the breed. So you have to be careful, and I'll let you guys to find out which breed it is, but it will look like a Cushing horse, and you could look pretty fool if you make a comment if that's the breed specific. So behavioral abnormalities, this is another one that farriers could pay attention to this, because these horses, not only because they are insulin resistant and they have a problem metabolizing that glucose to make it energy, so they're kind of lethargic, okay? They may have a concurrent disease at the same time. You know, they may have laminitis, so they wouldn't want to move too much. They may have some dental pain and so on. But bottom line is that with the Cushing disease, these horses have high beta endorphins concentrations that kind of makes them sleepy. And so that's kind of the same thing that we do when we apply a twitch to these horses. We kind of release those endorphins that they have in the muzzle, and the horses kind of get sleepy. Well, now you see the correlation between the Cushing kind of being behavioral quiet. Now the muscle atrophy that happens with Cushing disease, this is where you have to pay close attention, because these horses could look like a metabolic horse, or it could look like a real Cushing disease. Bottom line is that the predominantly those abaxial muscles and the gluteal muscles are the mainly affected, but these horses will still have abnormal fat depositions like the metabolic horses did. Those fat abnormal depositions are there because they're insulin resistant. They could have that long cresty neck like this one here, but look at the backbones of this one. You can see it have lost all the muscle mass in this area. So it's kind of an obvious sign once you see more than once, and when you correlate everything that's happening systemically to these horses, then you can kind of make and raise the awareness and the concern that this horse could suffering from Cushing disease. If you can correlate the feet problem as well as other things that you have seen while you're working on this horse. Those fat pads, it's very well known that Cushing horses will develop abnormal fat pads on that supraorbital fossa up in the above the eyes where the horses had that divot or fossa. These horses have a fat pad there, and the rest of the body looks emaciated like the ones in this picture, but then they have that fat pad and up above the eye, and that for sometimes if you see enough equine internal medicine cases, you'll see these horses getting into trouble with their eyes. If there's a correlation with that and the fat pad, I don't think so. I haven't seen any of them, but seems like you see them on and on. So there may be something there. PUPD, the PUPD stands for polyuria polydipsia. Polyuria is the excessive urination. Polydipsia is excessive water drinking. So horses that suffer from Cushing disease and affecting the adrenal gland, basically they lose the ability to concentrate their blood, so they lose a lot of that water through the urine, so they drink it back. So basically when you walk into the stall, those stalls are soaking wet, and that's another minor sign that you could be putting together to this clinical picture that you're dealing with for your treatment. As far as the foot, it could be successful. So if you come in and you see the stall is rank and this horse is drinking an excessive amount of water, noted by the owner, you can start making that owner be aware of this is what's is happening, and this is may you be dealing with this. Okay. Hyperhidrosis is not a common sign. This horse is not only because they have a thick hair coat, they can sweat more than normal horses, but sometimes these horses are in the winter and it's cold and they still sweating. So, and this is the winter when I took this picture. And it's not fully a Cushing horse, but it was interesting that it was over 18 years old, and it was hyperhidrosis when it shouldn't be. So did this raise the awareness of it and the concerns? Yes, definitely you have to put it together. But if you're dealing with feet problems in this horse, absolutely mention to it, because it could be what it will make a difference at the end for you to be successful. These horses that suffer from Cushing disease has been proved scientifically that these horses could suffer from mild infections, mild pneumonias that are unnoticed. The owners didn't notice anything and they were battling this mild pneumonia continuously. There are multiple reasons why this could be happening. There's high cortisol levels due to the adrenal gland being triggered. There's an increase in immune suppressive hormones that are in the system due to the fact of how the condition behaves systemically. So this horses definitely will need a different type of care. We'll see those secondary bacterial trying to take the opportunity to take over organs of the body, like we'll see with the skin in these horses. These horses could have rain rot, it could have other the facts of dermatitis that could be fighting continuously and not getting any better. So those things that you can mention them to the owner, not meaning that you're going to hit the jackpot with the diagnostic, but at least trying to raise an awareness. These horses definitely will need a more rigorous deworming protocol. More fecal samples should be drawn because since they are possibly immunocompromised, they will have a different type of burden of worms in their fecals that you should be addressing. For example, strong gels should not be in the fecals of adult horses. These horses most likely will have a large burden of strong gels in their feces. So sometimes you see this in this type of horses. Again, farriers see when the horse defecate there in the stocks, they usually clean it. So if you notice any of those things, make a note to the owner. We talk about laminitis and how those rings could implement any major systemic change in the body. I agree fully. It tells me a lot, not only how they're doing systemically, but what type of care they're being getting. And Cushing disease horses, you can tell how severe they're battling the Cushing disease looking at their feet. Some of these horses, they can never get right. You could have a team of experts trying to make this horse sound, and everybody's battling and nobody seems to get it right, and we see this very often. So more reason for these horses to get a more intense shoeing or trimming protocol. So again, some of these signs are going to be very subtle because the beta endorphins, these Cushing's horses that never show signs of laminitis, they've been investigated scientifically and proved that they did have changes, laminitic changes, when they look at them post-mortem. So they did not show any pain, but is it because they had high beta endorphins in their blood and they were more resistant to pain? Maybe, maybe not. But they are constantly fighting that mild pneumonia, that mild laminitis, and they are not showing any major signs. So the diagnostic of Cushing disease is not an easy one. So once you raise up the awareness of Cushing's, you're going to have to take in consideration that the veterinarian is not going to come in and possibly diagnose it. He may make some changes on the routine, but if you look at the list of the diagnostics used for Cushing's, a lot of the times they are not practical. It's very hard to implement in the system where they are or the routine at the farm. So a lot of the time they just put them on treatment. Depending where the routine is, I will push to make diagnostics. One thing that we have to make certain that we take home here on this message is that these horses that are Cushing, they're going to require a more intense care plan. So this horse is going to need a dental more commonly than any other horse in the farm, not because their teeth are growing faster, it's because they're growing uneven. And that sharp point is going to have to be taken, more routinely than the rest of the teeth in his mouth. That way the horse can prehend properly. Well, at the same time, you're going to have to address the diet. You are not going to feed the same diet and provide the same form of that diet. You may provide a mash instead of grain. And now where I want to get to is the trimming program. We know that Cushing disease horses do not produce or grow a nice looking foot. So how come I'm suggesting farriers to touch and trim these horses more regularly? And it doesn't make any sense, and it shouldn't, because those feet are not growing at the rate that it should be growing, but at the same time they are not growing normally. And if you don't, to me, if you don't care and pamper that foot and take care of the edges and round the breakover and try to provide the best environment where that foot can grow, you end up with no foot in 6 weeks. So sometimes the farrier needs to see these horses every 4 weeks and just round the edges, and that's it, done. But at least the foot is maintained in a more normal capsule and being able to grow a more normal foot. So that's the way I can explain a owner that I really would like these feet to be trimmed every 4 weeks and not every 6. At the same time, this horse has a knobby foot, basically. So it's very hard to get that point across owners. So now we're going to get a little bit more specific, a little bit more into the science, but it's definitely a message I want to drive to the farriers in the audience, where they need to start thinking, where their profession will look forward to, because there's a lot of need from their profession to help in the basically ICU, in the intensive care unit of horses, in the internal medicine service. I think there's a lot of need of the farrier skills on that area, and I'm going to show you why. So basically we're going to talk about multi-organ dysfunction syndrome, and this is how animals die. Basically the organs are failing and they are not able to recover and they die. So we describe that, and that's the main reason why ICUs or intensive care units are devoted to save these life of animals that are suffering from multi-organ dysfunction syndrome. So how everything started, this is just a diagram to explain things, a couple of abbreviations that I'm going to go through. But basically there's a disease process, okay? And that disease process brings bacteria into the blood. Now we have septicemia or sepsis. That bacteria in blood can be battled by the immune system, absolutely. But it depends on what degree or what amount of bacteria, what type of bacteria is getting in there. And then we have endotoxemia. So what's endotoxemia? So going back to sepsis, gram-negative bacteria is a great organism because once it's dead, it breaks into multiple pieces. And those pieces are going to be registered by the immune system. And the immune system is going to attack those little pieces and think that it's a live organism. So basically the immune system is going to exhaust himself fighting this bacteria that is already dead. So it creates a vicious cycle among the immune system and triggering the blood clotting cascade as well. So now we have multi-organ dysfunction created by the endotoxemic effect. That endotoxemia is going to damage the blood vessels on those organs. Once you damage those blood vessels or those organs don't have the command to tell the blood vessel, bring in the blood, say, hey, you need to vasodilate because I need more blood. No, that organ is going to send the command to vasodilate, and the vessel is not going to do nothing because it's been distracted fighting the endotoxemia effect and the endothelial damage that happened at the blood vessels, okay? So now that actually explains how multi-organ dysfunction happened. So we are not surprised that the foot is being affected right here after the endotoxemic effect. And this is where we shine here. This is where Farriers' knowledge should be driven more these days, in my opinion, because we definitely can help veterinarians at this stage. If we don't control the multi-organ dysfunction that's happening, then you have the multi-organ failure. With failure, that's how death happens. So when we look and pinpoint those areas that create the systemic inflammatory response syndrome, you look at organs that are very common and have a high incidence of endotoxemia, which is the digestive tract, the respiratory tract, reproductive, and so on as in this list. So looking at the GI tract, the most common disease process that we see is colics. We know that horses love to colic. So at the same time, I'm not saying that you guys should know what exactly is happening on colics. I just want you to put in perspective how this could become part of my practice. And I'm going to show you how it will become part of your farrier practice. When you have a horse that is colicky, this picture compared to this one, I mean, a lot had happened. I mean, I could be presented with this picture and I know how much trauma or how much insult this horse could have on the intestines. Meaning that if we go back to this picture, I know where we at here. I mean, we're not in the disease process. We're beyond that. Now we're suffering from endotoxemia because this horse is beat up. So the amount of damage that this horse, as the colic is happening, the amount of damage this horse had in the intestine, it could be severe. So I'm picturing this horse is at risk of developing endotoxemia. And if I see the signs of endotoxemia, I'll be addressing them immediately because I know what we have. For example, small intestinal volvulus, in this image, is a big bout, but the damaged area is not severe. But the amount of bacteria that can be produced by this lesion, it could be massive. And the fact that the only way to repair this is to basically undo the twist. Once you undo the twist and the blood vessels still intact, there's a rush of those bacteria that has been sitting there from the necrotic tissue. Now that barrier is being broken and the bacteria can translocate easily. Yes, surgically, they're going to remove this for sure. But the insult is already happened. So the horse is at risk already of developing endotoxemia by means suffering from laminitis subsequently. So we see this clinical picture all the time in the clinical scenario. Are we addressing with the right treatment protocol? That's up to the veterinarians. But we are here as Farriers to come up and say, well, how can I help these clinicians to achieve a better outcome in these horses? So basically during the developmental phase, that's when we can prevent. The developmental phase of laminitis is right before the pain is already showing at the foot level. So there is no inflammation at the lamina at that moment until it's triggered. Then you get the developmental phase. Now you do have inflammatory process down at the lamina. So you need to start preventing at that time. Preventing at that time will consist of doing many things that you will think that will get this horse comfortable and will set the bar for him to recover from this insult. So what you do, or what I do, is basically I do apply cryotherapy to the distal limb, which has been proved by Vanet and Pollitt. We talked about Pollitt already and how many achievements he has created for the laminitis. We follow his papers, done a great job. And these are a series of papers they did that will encourage farriers to read these papers. They may sound too scientifically complicated, but it's not. Just read them, get the overview. I think once you read them, you'll be very comfortable what you're reading because you have the knowledge for it. The There's many ways to do it. Van Epps have proved which are the ways that help. But bottom line is that I believe that farriers at this stage in a clinic will help the clinician tremendously, because it's not only about ice. We all know that. Ice has been proved to prevent and treat laminitis, but at the same time, if you guys put the perspective and the knowledge to get that foot conformation and getting comfortable and take that shoe off that you're comfortably taking off because you think is in disadvantage for this horse at this moment, and tell the clinician what your beliefs are, why is that not the proper conformation of the foot that the foot needs to recover from this developmental phase, and you guys know how much you know about the foot level, about that foot conformation that can help these horses. Yes, you need to put them on soft rides and so on. And actually, these are few ways to ice their feet. I learned from a farrier the best way I have ever done it. I was at the AFA meeting, and this farrier got up and said the way he does cryotherapy, he cuts the legs of the jeans, he cuts them off and basically puts them as boots, and he taped them with duct tape and fill them up with ice. And when I started doing that, it was amazing because the water will ooze out, so they're not splashing and they can walk around it. It was practical and convenient. The ice is contact with ice all the time. You can ice them all the way to the knees up, like Van Epps and Pollitt proved that is the best way to do it. On top of that, I've been putting a soft ride on the knees, so I basically take the shoe off, get it on the conformation I believe it will help the horse. That doesn't mean that I will do one thing for every horse. I may not take the shoe if it's too destabilized and I want the shoe there, but I put them on soft ride because I can fit the soft rides over underneath the jeans. So, and I incorporate everything. I'm trying to incorporate the foot, the ice touching the foot. So, but there's many ways you can do it, but I believe as a farrier, once you present yourself and make yourself available to these clinics, yes, you're not going to show up immediately when the horse show up, but then you can show up later on during the day, whenever it's convenient for you. The horse will be there, and probably they haven't taken the shoe off. And even though you're not going there to do something, you go there to learn, to establish a communication, and that's starting to put the two professions together. Okay, it's an effort from both sides, not just from one. All right. So thank you. Sorry for going over a little bit of time. Okay.